Hello, and welcome back to the ACED podcast. This is season 9, of course, where we turn science into sense. In this season, we provide 10 timely episodes with the hopes of helping listeners understand what we can learn from current research on harm reduction. And let me just say, there is so much here to learn. So, I'm glad you're with us. I'm Danielle Rudes, your host, and this is ACED. Welcome to the final episode of season 9. Before I start, I want to apologize because you're probably getting sick of me laying a bunch of statistics on you, and I apologize. But it is important for me to keep repeating myself so that you understand this is a major public health concern. So, with that, here we go again. Across the globe, there are about 29.5 million adults who suffer from drug use disorders. In the U.S., there are 2.5 million people who could benefit from medication-assisted treatment for those disorders, but only about 1 million receive them. Some of the people who receive MAT, or medication-assisted treatment, do so through home-based nursing staff. As we know from the other episodes in this season, one of the barriers for receiving treatment is constraints that come with office visits. There are problems with home-based treatment too, though. The nursing staff who provides at-home treatment do not have training in how to work with patients that have mental health problems and substance use disorders. This can cause them to have more negative attitudes toward these patients. Substance use disorders can come with a lot of stigma for people with them, especially during their treatment. They can face a loss of dignity because of how they are treated by healthcare staff. While we do know this, we do not know what dignity really means to people with substance use disorder or how they experience dignity with healthcare staff that provides home-based treatment. Hege Solberg from Inland Norway University of Applied Sciences and her colleagues looked at exactly this. They wanted to gain insight into the meaning of dignity for patients with substance use disorder in their encounters with home-based nursing staff. They were looking for answers to 3 questions. What is dignity for the patient? What could enhance the experience of dignity in these encounters? And what could be barriers to the experiences of dignity in the encounters? They answered these questions by conducting interviews with 6 patients who were receiving OMT medication from home-based nursing in Norway. The patients had a combination of treatment perspectives that included rehabilitation, harm reduction, or both. Once the interviews with patients were finished, Solberg and her colleagues transcribed the text and read through it to find themes in the words of the patients. They made sure to take into account their own biases when reading the interviews to try and keep those biases out, which is a best practice for researchers. When they were doing further analysis of the interviews, they used meaning coding, meaning condensation, and meaning interpretation. These stages essentially mean they assigned labels to section of the data or interviews that summarizes their meaning. Summarizing the meaning into data, that can mean analyzing and interpreting what was meant by the comment. Now to the good part, what they found from their interviews. When it came to the meaning of dignity, there were 3 main themes: the material dimension, to be respected by others, and the inner experience. For factors that can enhance dignity, the main themes were being respected and acknowledged, being cared for, and knowledge and persistent relation. Lastly, when it came to the factors depriving dignity, the themes were stigma and prejudice, insufficient relations, and lack of confirmation. Also, experiencing disrespectful or patronizing attitudes and lack of knowledge. Let's go into detail a little more on those themes and what they mean. The material dimensions of dignity included patients feeling that dignity was strongly connected to material things like money, standards of living, and other material goods. Patients felt a lack of dignity in periods of their life when they had few material goods, poor living standards, and a very difficult life. This meaning of dignity is not something that's really been seen in previous studies. The next meaning of dignity, to be respected by others, included patients stating a strong connection between dignity and respect. They felt that being respected and trusted by the people they meet is very important to their dignity. The last meaning of dignity was the inner experience. This is where patients describe dignity as a feeling that is within each individual. Moving on to the factors that enhance dignity, the first was being respected and acknowledged. Patients wanted to be met as the individual they are and be treated as every other patient who uses home-based services is treated. They want to be seen as fellow human beings. The next factor under this was being cared for, where patients appreciate that staff cared for them. They appreciated staff who were open-minded, were in a good mood, and showed care for the patient. The last of these dignity-enhancing factors was knowledge and persistent relations. Patients felt several factors about the organization of the service could enhance dignity. One of these being good continuity, as it gives the possibility for patients and staff to know each other. Patients also found the benefits of the staff having knowledge about substance use disorders and the patient's situation. What about the factors that deprive dignity? Well, the first of those was stigma and prejudices. The patients felt that staff's beliefs about substance use disorders were a barrier for dignity because it would cause them to be treated differently from other patients. They experienced being stigmatized and met with prejudice. They felt like when they were addressed in a patronizing way and looked down upon, they were being treated like an addict. The next factor that deprived dignity was insufficient relations and lack of confirmation. Part of this factor was the patients often having to wait for the staff, and sometimes they were even forgotten altogether. They felt like they were given lower priority than others who used the service. The last factor that deprived dignity was experiencing disrespectful or patronizing attitudes and lack of knowledge. This was about the patients feeling like the staff lacked knowledge about substance use disorder and had negative attitudes. They felt like this lack of knowledge about the OMT medication also influences the staff's attitudes toward treatment. Okay, it's a lot. Let me sum it all up. To patients, dignity can be something material, it can be respect, and it can be an inner experience or a feeling. Healthcare staff need to keep these things in mind when treating those with a substance use disorder to make sure they feel dignity in their treatment. Staff should be respectful and obtain training and knowledge on substance use disorders and their treatment to ensure not to treat patients with any stigma or prejudice. Doing this ensures that patients are getting a holistic approach to their treatment. It makes them feel better, and I venture that it will also aid in their recovery. Thank you for listening to the ACED podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters, Dr. Alyssa Toman from Texas State University and Sam Houston State University doctoral student Caitlin Bauer. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their spectacular production. Tune in again soon for another episode of ACED.